So I'm starting here. And now hip internal rotation can get a little bit more confusing because now if we were using our foot as the gauge, this is confusing because now hip internal rotation is this motion. So you see how my foot's coming out to the side, and that's because the top of my thigh is turning in. So I'm going to do 10 repetitions where I'm turning this leg in and my foot is going out. So now what's going to make this a little bit harder is now my hip is extended and now I'm trying to internally rotate. So I'm trying to think about getting to that end range of motion without compensating by flexing my hip. Some common compensations is that we're start to rotate too much. My right side is lifting and my pelvis is going. With it, I'm trying to push my pelvis down as I turn. Side view is like this. I'm trying to keep this front part of my pelvis down and I'm turning. So I'm just coming out to the side and then I'm coming back to neutral. What will happen sometimes is people will just start rotating like this. What I really want you to try to do is to just get that internal rotation, then back to neutral. Internal rotation, back to neutral. You're going to do 3 sets of 10 of these. I'm also trying to make sure that my ankle isn't moving at all. So what will happen sometimes is the ankle will start to do some different things to try to assist. I'm just trying to keep my ankle in one position. The progression is that you're going to bring your leg out into abduction. So now I'm moving it away from midline. Then I'll bend that knee and now I'm going to try to do that same thing, that internal rotation. Now I can really feel that this hip is going to try to lift up. I'm going to still try to press that down and pause. Press that down and then come back to neutral.